With polls showing Obamacare increasingly unpopular with Americans, the president continues his campaign to try to convince Americans that his health care overhaul is right for them. Well, under the plan, starting October of this year, people are going to have to compare between complicated plans and then choose the one that's right for them. But what if you don't have to pick any insurance at all? What if you just paid your doctor directly for the services that he or she provides? Does that sound too expensive? Well, my next guests say bypassing insurance and all the red tape actually keeps administrators and the bureaucrats out and makes health care more affordable. Joining me are three primary care doctors who offer alternatives to Obamacare: Dr. Michael Ciampi, Dr. Doug Nunemaker, and Dr. Marcy Zwelling. Good to have all of you here today. Thanks for joining us. All right, let me start with you, Dr. Ciampi. You recently took what some might consider a pretty radical step. You stopped all kinds of medical insurance in your practice, and you now just take patients and you tell them what the prices are. It's very open and transparent. What motivated you to do that?
Well, Governor, thank you. What's going on now, medicine is really devolving in terms of the financing of it. And I did this based on both moral and economic grounds. Economically, what's going to happen in Obamacare with the accountable care organizations, this is the HMOs of the 80s and 90s that we all hated, and actually even worse, because what they're going to do is give hospitals or accountable care organizations money and say, take care of Medicare patients. If you spend less, you get to keep more money. But if you spend more, the hospitals and the doctors have to pay to take care of these people. And that's just financially untenable for a primary care or really any doctor because the margins are so low now. And on moral grounds, if you incentivize an organization to take less care of someone, that person will get less care. What we did was we decided to post our prices in the office, online, opt out of Medicare. We don't take Medicaid or private insurance. We post the prices, we cut our prices in half, and we have people come in, they get the service that they ask for, they pay on the way out just like you would at the deli or at your mechanic or your grocery store, and the transaction's complete. It's a win-win for everyone.
I love that. I'll take a turkey sandwich and the appendectomy. That'll work. You know, one of the just follow-ups, did you lose patients when you did this? Because this is a big step. I mean, that is a radical departure from the way most people practice medicine.
It is radical. Well, it's kind of ironic that you pay for a service and you get it and you leave. It's kind of scary that it's considered radical, but we did have several of our Medicare patients decide to go elsewhere because Medicare will not allow them to get reimbursed for our services, which is very unfortunate. And some of our folks that have HMOs with very strict rules, they were not able to get referrals from me because I'm not contracted with them. But what we're seeing is people that have no insurance whatsoever or high deductibles are absolutely thrilled. I'm seeing people now that haven't seen a doctor in years because they couldn't afford it before.
Dr. Nunemaker, you're in Kansas. You have a similar but a little different approach. People pay an annual fee, and then they access into a network. It's like concierge medicine, something that I predicted 5 years ago would be the coming thing, and it has been. Tell us, when a person pays the fee, I guess it's monthly or annual, what does that access them to?
Basically, we realized when Dr. Umber and I started our clinic, we realized that the healthcare system is irreparably broken, and we had to throw as much value as possible at that membership. So what that actually avails them is truly unlimited access to office visits, home visits, work visits, and even technology visits, which are cell phone calls, texting, email, Skype, Twitter. You also get access to wholesale medications and lab work at up to 95% discounts.
Whoa, 95% off of what it normally would be. I mean, that's a big discount. That's huge.
Well, yeah, something, for example, a cholesterol test may be charged $60 to $90. We charge $3 because that's what it costs us.
Wow.
We also do all of our procedures are done for free as well. They're included. So if you need an EKG, you don't have to worry if I'm going to make $25 doing it. I'm going to do it if it needs to be done, and it costs me 40 cents in little electrode pads to do it. So if I need to put stitches in, we also do that for free. Did that just a couple days ago for a little boy. Strep throat testing, urinalysis. Anything we can do in the office is included to make that membership more valuable. But to be honest, what's really the part of the system that was really broken was insurance. And we decided to get out of it, but we realized that insurance is still necessary. So what we've been able to do here in Kansas, and hopefully on a grander scale, because our model is affordable to the masses by design, we've worked with insurance companies locally to write custom-designed, high-deductible insurance policies that have saved, in fact, saved one family $1,000 a month with the membership of our clinic, and one small company here in Wichita stood to get back approximately $250,000 in the first year utilizing an ERISA plan. One of the local companies even has seen what we can save them, and they will count our membership towards the deductible. So now your money's working twice as hard for you. It's just amazing what you can do when you utilize the free market. Seeing people say that we're radical, mechanics work for cash, pharmacists, veterinarians, electricians, plumbers. There's no reason that physicians can't do the same.
Well, Dr. Marcy Zwelling is also with us, and we're going to ask her about some of the changes she made in her medical practice, and we'll keep Dr. Ciampi and Dr. Nunemaker with us as well. Fascinating stuff. It may be the alternative you're looking for Obamacare. And how important is it for you to keep your medical records between you and your doctor? Because under Obamacare, your information is going to go into a government-run computer system. And we all know how secure that is right now. Stay with us. We'll be right back. We're back with our doctors. I want to bring in Dr. Marcy Zwelling. She's been with us before. We always love having her. Dr. Zwelling, some of these innovations are not new to you. You've been doing a number of years in your practice, not taking insurance. But I want to specifically address when Obamacare requires people to have insurance, but what they do, they work directly with you or Dr. Nunemaker or Dr. Ciampi. Are they going to have double coverage in a situation like that? Are they still going to have to satisfy the government too?
That's an excellent question, Governor, and the answer is no. Doctors such as Dr. Nunemaker and Dr. Ciampi, and by the way, I want to congratulate them and their patients for this wonderful opportunity that they've assumed. No, we have a section in Obamacare, 1301, that's a detail, but it is in the law that patients will be able to apply what they pay for us to the actuarial of their premium. So that will actually be deducted. Now, we have to wait for the government to come up with the regulations, and you know that Obamacare is a little bit behind the 8 ball here. So we're waiting for that to be put in the regulations. But it will be there. It is in the law. Yes, sir, it is.
I want to ask each of you, and Dr. Zwelling, let me start with you on this one. The privacy issue. Why is it that you would be able to keep our records secret, but Obamacare wouldn't?
Because we don't bill insurance, we don't send in those horrific codes that really are about billing codes. They're not about what's clinically going on with the patient. They're about a coding system. They absolutely violate privacy. Let me give you an example. If a patient came to the office and had a question about how they could prevent hypertension, something that runs in their family, I would be able to discuss it with them at will. It's already paid for in their retainer. I'd be able to follow up with them in a month to see if they understood what I said, if they had any other questions, as opposed to a doctor who works in the system, who would have to bill a code to get paid. That code would be hypertension, and that patient would be plagued with that diagnosis for the rest of their life. I would warn the patients in this country and every American that the IRS, the NSA, horrific what they've done to violate our privacy. But the HHS, the Health and Human Services Department, even worse. They have access to every record in this country. Every medical record, Governor. And every time we contribute to that by actually, there are new systems, they call them meaningful use. This is this computerized system where doctors put in boxes. They actually check off boxes. Yes, I did this. Yes, I did that. They get a bonus. They violate their patients' privacy to get a bonus. Well, on moral grounds, just as Dr. Ciampi said, I could not do that. I will not do that. My patients' records never leave my office.
We've only got a couple of minutes, so I've got to be very quick here with both Dr. Ciampi and Dr. Nunemaker. Dr. Ciampi, are your patients protected in the manner in which you provide medicine so that they don't have to give up a lot of things, whether it's their Social Security number or details about their health care and their medical conditions?
Well, they are now. Originally, I had tried to cooperate with the electronic medical record program that was part of the stimulus package. It was an absolute nightmare. I was working for the computer, not for the patient. And when I did this at the beginning of the year, I scrapped that. Everything is back to paper charts. I no longer ask for anyone's Social Security number. I don't want it. If someone was going to get my patient's records, they'd have to break into my office to do it at this point.
And Dr. Nunemaker, is it that you're actually seeing patients for longer periods of time? And, you know, I'm not asking you to reveal anything about personal income, but you're making house calls. I mean, I haven't heard of that since watching Marcus Welby on TV. So are you able to make as much money as you would have if you were in the government kind of controlled healthcare system?
Well, no, but my lifestyle and income is actually better. I can provide better patient care, but without the administrative costs and overhead, it's amazing. We actually statistically looked at it. 22% on average of a physician's time is administrative overhead, mostly insurance. If you take that 22% out, times all the physicians in the country, you've added 165,000 new doctors to the workforce. But we consider ourselves Marcus Welby with an iPhone. We do enjoy those house calls, and we want to bring back the high-touch feel of medicine. And I couldn't agree more with Dr. Zwillinger that your privacy is very much not secure. HIPAA is actually a huge barrier. The Health Insurance Portability and Accountability Act has no use whatsoever in this day and age. When it was written, the Spice Girls were at the top of the charts. It needs to be overhauled.
Well, I want to thank all of you. It has been an absolutely fascinating and informative conversation to find out that it doesn't have to be all one size fits all. Let Obamacare do it. Dr. Ciampi, Dr. Nunemaker, and Dr. Zwilling, all of you, thank you very, very much for being with us today and giving us a lot to think about.
Thank you, Governor.
I hope they're listening in Washington. I hope they understand that there are better ways to give health care to American citizens than this incredible big government solution called Obamacare. Let's hope that somebody will pay attention. I certainly did.